So the purpose of this annual tour was to give our members a little bit more experience with trauma that they might not normally get if they don't work in that scenario in their civilian job. So it's a really great opportunity for them to see things that they don't normally get on a regular training days. Because it's actual live patients, it's not simulation, it's real trauma.
We want to train as many military medical professionals as we can. So the different parts of our program involve active duty as well as the Guard and Reserve, but our part really is with the Guard and the Reserve so that we can give them an opportunity to practice their craft before they get deployed. There's other programs that will take smaller parts of the medical professionals, but we take ancillary folks as well, just like we have your dental techs and your dentists come here. We also have radiology techs and pharmacy techs that come here as well. So that's part of part of our draw, that we can take the whole unit to come here together.
So when we first got here, we went through 1 day of orientation. The next 3 days we had lectures. We had lectures from brain surgeons, ophthalmology, we had nurses come in and give us lectures. And then over the course of the end of the week and into this week, we were working in different parts of the hospitals, doing rotations throughout 2 other hospitals. So we rotated through the emergency department, trauma, endoscopy. Some of us went through the burn center, just to give us a feel for different parts of the hospital.
During our reserve weekend, we do physicals, so using our skills that we know to keep up to, the IVs and EKGs and just the trauma stuff that we're seeing here to keep up our skills is really important.
Our medical employees, the nurses, and all the ancillary folks in the hospital, they love having the military here. They want them to be here, and it is absolute pleasure to be the conduit to allow the military medical professionals to work with our employees.
The partnership is really excellent. It's a symbiotic relationship. Both people are getting something out of it. The military are definitely getting the experience that they wouldn't otherwise get, and the hospital employees and staff are getting some extra help, and certainly the community is benefiting as well.
If we could get more civilian hospitals to do something like this partnership that the military has with HonorHealth would be beneficial to our military members. We really need this one-on-one, contact with real patients. So if we could get more people on board to have these training programs and then working in the hospitals, man, we'd be a better Air Force for it.